Hello everyone, welcome back to another session of microbiology. This chapter will begin our discussion of select topics of diseases. Chapter 21, Skin and Eye Infections. We have previously discussed the structure of the skin in our discussion about the first line of defenses in the immune system, but let's continue to cover it in more details. So there are two layers of skin cells. There is the epidermis, which is a thin outer layer of dead cells, and a fibrous structural protein known as keratin. Within that layer is dermis, which is a thick layer of connective tissue. Existing in these two layers are hair follicles, sweat glands, and oil glands that you see in the right image. And these glands can be responsible for creating acidic and oily conditions, as well as releasing salt. And so what we find with the skin is it tends to be very dry, salty, and acidic. And as you all well know by now, dry, salty, and acidic conditions are conditions that inhibit microbial growth. So, follicles and glands on the one hand cause the skin to be salty and acidic. However, on the other hand, they are portals of entry for certain microbes. Upon our skin grow our normal skin microbiota. Most of these residents tend to be resistant to drying and salty conditions, or halophilic. Examples include Staphylococcus and Micrococcus. You will find that parts of the body that trap perspiration, for example the armpits, allow a much wider array of microbes to grow, and therefore they tend to be more diverse in the number of microbes. And you will also find that certain microbes grow only or are restricted to growing on certain parts of the body. For example, hair follicles, where Cutibacterium grows.
Corynebacterium xerosus is a normal resident of the surface of the skin. It cannot grow inside follicles or glands. How would C. xerosus be classified based upon its oxygen requirements?
In this discussion, we will cover 4 different groups of microbes that cause diseases of the skin. They include bacterial, viral, fungal, and parasitic. So let's begin with bacterial. One of the most common causes of bacterial skin infections are Staphylococcus. Their characteristics include that they are spherical and gram-negative, and some, not all, produce blood-clotting coagulase, which is a virulence factor for the organism. Coagulase causes blood clots, which may protect some bacteria from phagocytosis. Coagulase-negative bacterium is Staphylococcus epidermis, and it comprises 90% of the skin microbiome and is only pathogenic when the skin is broken. And it can colonize indwelling devices and biofilms. In fact, Staphylococcus epidermis is the most common cause of infection due to indwelling devices. Next up is Staphylococcus aureus, which is coagulase positive, and most pathogenic species of Staphylococcus are of this group. It is very common in the population. About 20% of the population has a permanent Staphylococcus aureus in their nasal passages, and about 60% have a transient population of Staph aureus. They tend to cause infections through the parenteral route, which means entry of the pathogen through skin and mucous membranes when these barriers are breached. Staph aureus comes with a full suite of metabolic chassis that allows them to become pathogenic. They have a genome which is 300,000 base pairs larger than S. epidermis, which is about 10% larger. So these virulence factors include proteins that block immune reactions, such as protein A, which attaches to antibodies on their flag or their constant region. These constant regions are what interact with our immune system to elicit a immunogenic response. They also have toxins that kill phagocytes directly, and they have compounds that allow them to survive phagocytosis. They have proteins that neutralize produced antimicrobials, and their cell wall is lysozyme resistant. Lysozyme is an enzyme that our body produces in order to break down certain linkages in peptidoglycan of the bacterial cell wall. And lastly, antibiotic resistance is not uncommon among Staph aureus. The process of Staphylococcus aureus infection begins pretty simply, where these microbes are transported to the hair follicle, and a small infection begins at the follicle, and this is called a folliculitis. Folliculitis can grow and develop into a more serious furuncle or boil, and this furuncle may invade surrounding tissues and become a carbuncle, which you see off to the right, causing generalized illness. Staphylococcus may also cause a very common disease and highly contagious skin infection called impetigo, which is usually seen in children of the age 2 to 5. And as you can see at the bottom here, it results in sores and overall puffy and inflamed areas on the face, typically. It can also cause scalded skin syndrome, which is a form of impetigo caused by the exotoxins that the Staphylococcus produces. On a separate note, you should be aware that Staphylococcus also tends to be the causative agent of toxic shock syndrome, which is caused by Staphylococcus growth from using a tampon for too long. And again, due to certain exotoxins that the Staphylococcus produces. The next bacterium to discuss are Streptococcus bacterium. Here you can see they're spherical and gram-positive, and as the name implies, they grow in chains. Some species secrete hemolysins. These hemolysins will be very important in an upcoming lab, and what they do is they break down red blood cells. And there are 3 different types of hemolysis that we need to be aware of. There is alpha hemolysis, which is a partial breakdown of red blood cells, and then there's beta hemolytic or lysis, which is a complete breakdown of RBCs. And then there is gamma hemolysis, which is where hemolysins are not produced and there is no breakdown of the red blood cells. And as you can imagine, beta hemolytic species are most pathogenic. Group A beta hemolytic streptococci, such as S. pyogenes, are one of the most common human pathogens associated with many virulence factor. One such factor is the M protein, which inhibits an immune response and therefore phagocytosis. If you look to the image on the right, you will see that the M protein is expressed on the outer surface of the cell wall of the bacterium. And what it does is it binds fibrinogen, which masks the bacterium from complement proteins and disguises it. They also produce hyaluronic acid capsules, which prevent antibody formation. And these special enzymes allow for rapid spread throughout the tissues. The next major group of bacterium that cause skin infections are Pseudomonas. And so they are rod-shaped and gram-negative, which is different than the previous two examples of Staphylococcus and Streptococcus. They are aerobic. and they are capable of surviving on unusual carbon sources. They are resistant to many antibiotics and disinfectants. Pseudomonas aeruginosa is a common opportunistic pathogen. An opportunistic pathogen is one that is usually not pathogenic, usually just as a normal part of our microbiota, but when certain times arise, it may change its mode of function and behavior and become a pathogen. These bacterium, like many pathogenic bacterium, have a very large genome with a broad range of metabolic capacities and virulence factors.
Checkpoint 2. Are members of Staphylococcus and Streptococcus gram-positive or gram-negative? What about Pseudomonads?
P. aeruginosa is often responsible for a couple common infections that are acquired from swimming pools and hot tubs. The first is Pseudomonas dermatitis, which is a rash that one can get with papules and pustules. This is self-limiting in that it clears up on its own and lasts for only about 2 weeks. The other one is swimmer's ear, referred to as otitis externa. This infection is of the external ear canal leading to the eardrum. And just one point of clarification, it's not always the cause of swimmer's ear, but it is one that is commonly responsible for it. Pseudomonads are often a cause of Pseudomonads are a common cause of hospital-acquired infections. These are known as nosocomial infections. They are the most frequent pathogen isolated from patients in the hospital who have been there for more than 1 week. They tend to be opportunistic in second and third degree burn patients. And they can form dense biofilms on indwelling devices such as catheters. And now let's switch gears a little bit and talk about the most common type of skin infection, and that is acne. It affects 17 million people in the United States, and greater than 85% of teenagers have it. It's caused when shedded skin cells and sebum clog hair follicles. There are 3 types of acne. There's comedonal, inflammatory, and nodular cystic. Comedonal is a mild form of acne which is caused by clogging of the follicle, and it's treated typically with topical agents like retinoids and salicylic acid. Inflammatory is a moderate form of acne. It's typically caused by Cutibacterium acnes and Propionibacterium acnes, which can metabolize sebum. Sebum is that oily substance that your skin excretes. And these are treated with antibiotics or drugs that reduce sebum. Next is nodular cystic, and this is a severe form of acne. It's a progressive form of inflammatory acne, which is characterized by very deep pus-filled lesions, and it can be treated with Accutane. So that wraps up our discussion of bacterial microbial diseases. Let's now move into viral diseases. And as you can see here, there's quite a few of them to cover. So we'll try and keep this as brief as possible. Warts are a benign skin growth that occurs by the papillomavirus. Its incubation period is several weeks, and it is treated by freezing and drying the area and with topical acid or lasers in order to destroy the area of the skin and remove the viral particles.
Checkpoint 3. Why aren't antibacterial drugs a useful treatment for warts? What microbe is the cause of warts?
Smallpox is caused by variola virus. Variola major has an adult mortality of 20 to 60% and a child mortality of 80%, whereas variola minor has a low mortality rate of less than 1%. The portal of entry are mucous membranes of the respiratory system. Systemic infections lead to infection of epidermal layer of and creates pustular lesions. So this is the only human disease that has been completely eradicated worldwide through the use of vaccines. Polio is very close and now only exists in Pakistan and Afghanistan. Next up is chickenpox and shingles. They both come from the same virus. It's caused by varicella virus HHV3. For chickenpox, the portal of entry are mucous membranes of respiratory system, and the infection becomes localized in the skin after about 2 weeks. And it's characterized by vesicles that rupture the scab. Shingles is caused by latent HHV3 in nerve cells of the dorsal spinal cord. So you do not get shingles from exposure from the environment. What happens is an individual already had exposure to chickenpox, and the HHV3 lies dormant in our systems, and we're long-term carriers for the rest of our life. Under certain conditions, it can be activated. This activation is usually triggered by a lowering of the immunity, typically with age. And it's expressed a little bit differently than chickenpox. Chickenpox can occur, kind of around your torso or your body and your limbs, etc. But because shingles hides away in the nerve cells of the dorsal spine, you tend to see it following those nerve cells down on a path. So it grows along the side of the torso from the back side towards the front of the belly. So in between these two stages of having chickenpox and shingles, you are not infectious to anyone else because you do not have an active form of the virus. However, during an active outbreak of chickenpox or shingles, you are contagious. You may spread the virus to other individuals.
Checkpoint 4. Explain whether a patient can get shingles before chickenpox.
Next up on our list is herpes. Herpes is the disease that is caused by herpes simplex virus HSV1 and HSV2. HSV1 is primarily transmitted orally, and it infects roughly 90% of the US population. Most infections, however, are asymptomatic, but some of them can manifest as temporary vesicles at margins of the lips, and these are called cold sores. HSV2 is primarily transmitted sexually. And most of these infections are asymptomatic, but sometimes manifest as temporary vesicles called blisters. For the exam, you must know which one is primarily transmitted which way. But in the actual case is that these can be transmitted orally to sexually and sexually to orally. But primarily HSV1 is thought of as the oral version and HSV2 is thought of as the sexually transmitted version. Next up is measles or rubeola, which is not the same as rubella. They are caused by different viruses. It's caused by measles morbillovirus. It's extremely contagious. It's extremely dangerous for infants and the elderly. And the portals of entry include mucous membranes of the respiratory system, A systemic infection is characterized by rash that starts on the face and spreads to other parts of the body. And in the US, vaccination has largely eliminated the disease in the US. Outbreaks continue to happen due to travelers coming into the country and reintroducing it, but overall, it's been eliminated from the US. Although resistance to vaccination has led to some recent spikes in measles cases as well. Okay, rubella, which is also known as German measles. The term rubella basically means little red. Port of entries include mucous membranes of respiratory system. It's a systemic infection characterized by a rash of small little red spots. And it has mild symptoms and a low mortality rate. Contraction during the third trimester causes congenital rubella syndrome in 35% of cases, which includes deafness, cataracts, heart defects, mental retardation, and death.
Checkpoint 5. Which herpes simplex virus is most common amongst the U.S. population?
Okay, let's move right along with talking about fungal infections. Two main types include cutaneous mycosis, which is a fungal infection of the hair, nails, and surface of the skin. Tinea or ringworm is a very common example of this. It's transmitted via direct contact with fomites. It is self-limiting, so it typically clears up on its own after a couple of weeks. You may also see subcutaneous mycosis, which are fungal infections that penetrate the dermis. These are typically much more serious than cutaneous mycosis. They're usually caused by soil fungus, and the port of entry are skin wounds. You can get yeast infections that are caused by an overgrowth of the dimorphic Candida albicans on mucous membranes. Dimorphic just means that it can exist as individual yeast cells, or it can have a typical fungal growth pattern, as you can see on the image on the right. Normally, this organism is kept in check by our normal microbiota, but when there's a breach in this system, we can have three different sources or three different types of yeast infections, which are vaginal, oral, which is also known as thrush, and systemic candidiasis, which is rare. It's most common after an antibiotic treatment or in immunosuppressed individuals. Okay, last one is parasitic, and we're just going to cover lice. Lice, pediculosis, is caused by Pediculus humanus capitis. The legs are adapted to grasp hairs, and they can colonize the scalp and feed on blood of the host. They are highly transmissible through direct contact, and they are treated with topical insecticides or mechanical removal procedures. And that wraps up our first round of select diseases. We'll see you for chapter 22. Thank you.